Okay, so basically today we are going to talk about the algorithm for postmenopausal bleeding. So let's say that a patient comes to you with postmenopausal bleeding. What is going to be the algorithm for that? So what are you going to do? So after taking a complete history regarding the bleeding and the effects, whether she is undergoing anemia, like she's having symptoms of anemia and other health conditions because of excessive blood loss, we are going to follow the following algorithm. First of all, you're going to do a speculum examination. Okay. Now, in that examination, if you find a growth, okay, let's say any mass or any polyp or anything, this means that a gross abnormality is present. So in this case, we are going to do a simple biopsy, a punch biopsy of that gross abnormalities. So punch biopsy is to be done, and then we are definitely going to study that histopathological examination and proceed with that. But let's say that the per speculum examination is normal. Now what are we going to do? If this is normal, first we did the per speculum examination. Now if this is normal, then we are going to go for transvaginal ultrasound. Okay, transvaginal ultrasound is the second step, and in this case we are going to look at the endometrial thickness, ET, and let's say the cutoff mostly is 4 millimeter. Now if this thickness is less than 4 millimeter, then this means that the cause is atrophic endometritis. Okay, now this atrophic endometritis is not a red flag and it's not as dangerous as a carcinoma, so we are simply going to observe the patient and follow up and re-evaluate the patient. Okay, but let's say that the thickness is more than 4 millimeter. Now the patient is in trouble. Okay, if this is in more than 4 millimeter, then endometrium is very thick, and this can be endometrial hyperplasia, or it could have developed into carcinoma. So we are going to go for endometrial aspiration. Okay, now you're going to go for endometrial aspiration, and this is a simple OPD procedure, and this is a very basic first step that we're going to take if we have endometrial thickness more than 4 millimeter, like if the endometrium is abnormally thick. Now if this is normal, because this is not a very sensitive, okay, if endometrial aspiration that we took, if the sample is normal now and patient still continues to bleed, now what are we going to do? We are going to do fractional curettage. Okay, fractional curettage, and this is done with a hysteroscope preferably. Now please remember this term because this is the gold standard. Okay, fractional curettage with a hysteroscope is the gold standard for a patient who presents with postmenopausal bleeding and whose endometrium is thicker than 4 millimeter. In that case, the gold standard is fractional curettage with a hysteroscope. So hysteroscope is going to be done, and this is preferably done under general anesthesia. This is a rather invasive procedure as compared to aspiration, which was a very simple OPD procedure. Okay, now what we're going to do, now we're going to take this curettage with the help of a hysteroscope and study that. Histopathological examination is to be done and find out whether there is simple hyperplasia, complex hyperplasia, or atypia, or whether this is a carcinoma. So this was the algorithm. Now what are the causes? Okay, so basically overall, most common cause, like overall, is carcinoma cervix. Okay, most common overall, but if we specify the causes to the uterus, if we limit it to the uterus and we talk about uterine causes exclusively, then we have atrophic causes. Okay, atrophic endometritis. This is a very important MCQ in which they ask that there's an old woman and she is suffering from postmenopausal bleeding and there is no other red flag. Okay, no red flag. So what is the probable cause? The answer is atrophic. It can be atrophic vaginitis, it can be atrophic endometritis, but atrophy of the genital tract. Okay, this is the answer. Like a simple presentation of an old woman with postmenopausal bleeding is due to atrophic endometritis or vaginitis. Okay, now what are we going to do? Basically, we're not going to do anything. We're just studying the causes. So basically, other causes in the uterus are if the a woman is taking estrogen replacement therapy. Okay, this is also a cause if she is having a polyp, an endometrial polyp, or endometrial hyperplasia, or carcinoma. Okay, all these things. So almost 10% cases are because of endometrial carcinoma. But this is a very important presentation of endometrial carcinoma and postmenopausal bleed with endometrial thickness of more than 4 millimeter. What is the gold standard? It is hysteroscopy, in which we do a fraction curettage. Okay. Okay. So this is it.